This is All India Radio. We now bring you a special program on COVID-19. Good evening. I am Lalima Aneja Dang and with me is Vaibhav Srivastav. The headlines. Prime Minister Narendra Modi participating in ongoing NAM summit with focus on enhanced coordination of member states in fight against COVID-19. Recovery rate of COVID-19 cases improves to over 27.5% in the country. Doubling time of cases slows down to 12 days. Government to facilitate return of Indian nationals stranded abroad on compelling grounds in phased manner from Thursday. Indian Railways to bear 85% of migrant workers' train fare and 15% by respective state government. More than 92,000 NGOs and civil society organizations mobilized by the government to combat COVID-19 and help migrant workers and needy people. And UPSC Civil Services Preliminary Exam 2020 postponed due to COVID-19 pandemic. Prime Minister Narendra Modi is participating in a virtual summit of the Non-Aligned Movement, NAM, on COVID-19 pandemic, which is underway. The summit has been organized at the initiative of Azerbaijan President Ilham Aliyev to enhance coordination of member states in fight against COVID-19. The Azerbaijan President is the current chair of NAM. This is the first NAM meeting that Mr. Modi is taking part since becoming Prime Minister in 2014. The summit is likely to discuss and decide on the enhanced coordination of the member states in their fight against the coronavirus pandemic. The summit will conclude with a political declaration of the movement as uniting against COVID-19. NAM represents the biggest grouping of countries outside the United Nations, comprising 120 developing countries from Asia, Africa and Latin America. A total of 2,553 fresh confirmed cases of novel coronavirus or COVID-19 have been reported in the country in the last 24 hours, taking the total number to 42,553. Out of them, 11,706 patients have recovered so far, with the recovery of 1,074 patients in 24 hours. Briefing media in New Delhi today, Health Ministry officials said that the recovery rate of patients from COVID-19 infection has gone up to 27.52%.
टोटल 11,706 लोग क्योर हो चुके हैं और अगर हम पिछले 24 घंटे में देखें तो 1,074 people have been cured. It is such a positive news that this is the highest number in terms of cured patient noted till date. और इसके साथ ही हमारा रिकवरी रेट अब देखें तो है बढ़कर 27.52% हो चुका है.
The official said doubling time of COVID-19 cases has improved from 3.4 before lockdown to 12 days now. He said lockdown and containment efforts are yielding results. The challenge now is to improve this, resulting in further increase in doubling time. Outcome ratio, which indicates status of closed COVID-19 cases among people who either recovered or passed away, improved to 90:10 today, which was 80:20 on the 17th of April. The official said that we are transitioning to a new normal where we need to compulsorily wear face masks and covers in public places and to follow preventive measures outside containment zones as well.
लॉकडाउन के बेनिफिट्स को बनाए रखने के लिए हमें सबको मिलकर यह इंश्योर करना होगा कि हम सब अपनी सोशल रेस्पॉन्सिबिलिटी को समझें और लॉकडाउन ईज होने के समय पर भी सभी प्रोटोकॉल्स और गाइडलाइंस का डिलीजेंटली पालन करें. जिन जिले में केसेस अभी तक रिपोर्ट नहीं हुए हैं वहां पर अगर केस आएंगे तो वहां पर फिर से रेस्ट्रिक्शन लागू की जा सकती हैं. हम एक नए नॉर्मल में ट्रांजिशन कर रहे हैं. जरूरत है कि हम सब लोग सावधान रहें, सजग रहें और सतर्क रहकर कोविड-19 से निपटने की अपनी तैयारी को इसी स्पीड और मोमेंटम के साथ बढ़ाते रहें.
On the issue of charging of train fares, the Health Ministry officials said that permission has been given to run special trains for movement of stranded people based on request of state governments. He said the central government has not ever talked of charging train fare for workers. He said 85% of fare is borne by the Indian Railways and 15% by the respective state governments. The Home Ministry official said that the control room set up by the ministry is working round the clock and 12,000 grievances have been addressed till the 3rd of this month. She said the government has asked the states to ensure that there are no issues in interstate cargo movement.
गृह मंत्रालय ने राज्य सरकारों को अनुरोध किया है कि वे ध्यान दें कि इंटर स्टेट कार्गो मूवमेंट में कोई समस्या न आए। आर्थिक व्यवस्था को गति प्रदान करने के लिए तथा आवश्यक वस्तुओं की आपूर्ति के लिए ट्रक और गुड्स कैरियर्स की आवाजाही में कोई व्यवधान नहीं आना चाहिए। इस क्रम में मैं सभी वाहन चालकों को बताना चाहूंगी कि अगर उन्हें अंतर्राज्यीय आवाजाही में कोई भी समस्या आती है तो वे टोल फ्री नंबर 1930 पर कॉल कर सकते हैं। अगर वे नेशनल हाईवे पर हैं तो वे NHAI के हेल्पलाइन नंबर 1033 पर सहायता के लिए कॉल कर सकते हैं।
The official explained that in view of increasing COVID-19 infection among police and security forces, Union Home Ministry has issued advisory to all states, union territories and central armed police forces, drawing attention to the guidelines issued by it on safety at workplace. During the briefing, Chairman of the Empowered Group 6, Amitabh Kant, gave details of how the group has been engaging with civil society organizations, NGOs, industry and international organizations to combat COVID-19 and galvanize action on various fronts. He said the group has mobilized more than 92,000 NGOs and civil society organizations, appealing them to assist states and districts in identifying hotspots, helping migrant workers and other needy people. He said Aspirational Districts program piloted by Niti Aayog has been a big success in uplifting lives of millions in 112 most backward districts. He informed that there are 610 cases in these districts, which is fairly low, and it is less than 2% of the national level. He also said that telemedicine feature has been incorporated in the Arogya Setu app, and about 19 million installations have been made so far.
आरोग्य सेतु ऐप के साथ जो हम लोगों ने काम किया था उसमें अब टेलीमेडिसिन फीचर भी लग चुका है और करीब ये आरोग्य सेतु ऐप अब करीब 90 मिलियन इंस्टॉलेशंस इसके गूगल पे स्टोर में लग चुके हैं और ये अभी शॉर्टली इसका फीचर फोन ऐप भी निकलेगा।
Union Health Minister Dr. Harshvardhan said that India's fight against COVID-19 has been exemplary. He added this has been acknowledged by every Indian and people all across the globe, including WHO. In an interview to a private news channel, Dr. Harshvardhan reiterated that there is no evidence of community transmission of COVID-19 in the country. The minister said that the measures taken by the government have saved the country from stage 3 transmission.
As far as our cases in India are concerned, we have checked on number of occasions at number of places through random samplings also, and we could not find significant number of people who have got the disease about whose contact tracing we could not do successfully. So I am again reiterating that we have saved the country from going into the stage 3 of transmission, which is popularly called as community transmission.
On testing capacity, the minister said 10 lakh tests have been conducted and the government is doing it in a very judicious manner. He said the government has planned to test 1 lakh samples per day. The third phase of lockdown with different relaxations in green, orange and red zones has come into effect till the 17th of this month. The centre had on Friday announced extension of lockdown for 2 more weeks with considerable relaxations in lower risk districts. The Health Ministry has divided over 700 districts of the country into red, orange and green zones, and the centre's guidelines will be followed according to the zone. Union Minister Prakash Javadekar has said that in green zones practically all day-to-day activities have been allowed, barring congregations. He said the government wants to give the message that India is undergoing a phased exit from the lockdown where more and more activities are allowed to be conducted. In the national capital, Delhi government has implemented relaxations following the Home Ministry's guidelines. All government offices have been operational from today in the city. Those involved in essential services will see 100% attendance, and for non-essential government departments, only Deputy Secretary and 33% staff are allowed to report to work. Private offices can function with 33% staff. Suspension of travel by flight, Delhi Metro and bus will continue in the national capital. Plying of cycle rickshaws and auto rickshaws, running of taxis and cab aggregators, intra-district and inter-district plying of buses will remain shut. Schools, malls, gyms and social, political, cultural and sports gatherings will remain banned. Salon and barber shops will remain closed. Our correspondent has more details.
No movement of people will be allowed from 7 p.m. to 7 a.m. Those aged above 65 years, pregnant women, those with pre-existing medical conditions and children below the age of 10 shall continue to stay at home except for meeting essential requirements and for health purposes. Outpatient departments, OPDs and medical clinics shall be permitted to operate in red, orange and green zones with social distancing norms and other safety precautions. However, these will not be permitted within the containment zones. Self-employed personnel are allowed to resume commercial activities. Corner Place, malls and markets will remain closed, barring shops selling essential goods. Stationery and standalone shops will be allowed to open. Print and electronic media, private security firms can open. Firms involved in manufacturing and supply of essential goods will be allowed to open. IT, hardware and e-commerce firms will be allowed to provide essential services. No liquor shop will be allowed to open in COVID-19 containment zones. Private vehicles carrying a driver and 2 rear passengers will be allowed to commute, but only to access essential services. Wedding functions with 50 people is allowed. Funeral is allowed with maximum 20 people. With Anand Kumar, Anupam Mishra, AR News, Delhi.
As many as 20 central public health teams from the Ministry of Health and Family Welfare have been formed and are being sent to the 20 districts that are reporting the maximum number of COVID-19 cases in the country. These districts are Mumbai, Pune and Thane in Maharashtra, Ahmedabad, Vadodara and Surat in Gujarat, South East and Central Delhi, Indore and Bhopal in Madhya Pradesh, Jaipur and Jodhpur in Rajasthan, Kurnool, Krishna and Guntur in Andhra Pradesh, Agra and Lucknow in Uttar Pradesh, Chennai, Hyderabad and Kolkata. These teams will support the states in implementation of containment measures for COVID-19 in the affected areas within these districts and cities. Tamil Nadu witnessed a big spike in the number of new COVID-19 cases today. On the first day of partial relaxation of the lockdown restrictions, 527 people were confirmed with the infection, which is the largest ever single-day count. Officials attribute it to the massive hike in the number of tests in focused areas like the Coimbatore wholesale market in Chennai, which has emerged as a major COVID-19 hotspot. The total number of infected cases in the state has climbed to 3,550, while the active caseload is 2,107. The total fatalities have risen to 31 as one more person died of the disease. Meanwhile, the 3-member Central Public Health Team led by Dr. Rakesh Singh of JIPMER visited several COVID-19 treatment facilities and containment zones in Chennai today and reviewed the prevailing situation. Here's more from our correspondent.
In view of the extended lockdown, the state government has issued orders to distribute free rice to all ration card holders for this month, ranging from 20 to 50 kilograms of rice, depending on the number of family members. Besides, dal, palm oil and sugar are also being distributed freely. The State Food Department in a press release says nearly 2.45 lakh metric tons of paddy has been procured from farmers during the lockdown period, from March 24 to April 30. The total paddy procurement in the whole season is expected to touch a new high of 28 lakh metric tons. However, in several pockets, orders for horticultural producers from traders are drying up. Kisan Rath mobile app by the centre and the Ulavan app by the state provide some respite to such farmers. Jai Singh, AR News, Chennai.
Prime Minister Narendra Modi is participating in the NAM meet through video conference. We go live now to listen to his address.
Excellencies, in the founding spirit of movement, let us aim today to come together, not grow apart. Each of us can be saved from the pandemic only if we all are. Let us work as partners towards an inclusive and cooperative global response. Thank you. Thank you, Excellencies.
This is All India Radio, bringing you a special program on COVID-19. A reminder of the headlines before we move on. Prime Minister Narendra Modi participating in ongoing NAM summit with focus on enhanced coordination of member states in fight against COVID-19. Recovery rate of COVID-19 cases improves over 27.5% in the country. Doubling time of cases slows down to 12 days. Government to facilitate return of Indian nationals stranded abroad on compelling grounds in phased manner from Thursday. Indian Railways to bear 85% of migrant workers' train fare and 15% by the respective state governments. More than 92,000 NGOs and civil society organizations mobilized by government to combat COVID-19 and help migrant workers and needy people. And UPSC Civil Services Preliminary Exam 2020 postponed due to COVID-19 pandemic. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Government of India will facilitate the return of Indian nationals stranded abroad on compelling grounds in a phased manner. Indian embassies and high commissions are preparing a list of distressed Indian citizens, and the travel will begin in a phased manner from the 7th of this month. The travel will be arranged by aircraft and naval ships. Home Ministry said this facility will be made available on payment basis and non-scheduled commercial flights will be arranged for air travel. Medical screening of passengers will be done before taking the flight, and only asymptomatic passengers will be allowed to travel. During the journey, all these passengers will have to follow the protocols of health and civil aviation ministries. On reaching the destination, everyone will have to register on the Arogya Setu app. The Indian nationals will also be medically screened, and after they will be quarantined for 14 days, either in a hospital or in an institutional quarantine or on payment basis by the concerned state government. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Uma Kumar, head of Rheumatology Department AIIMS, suggested to the people to follow social distancing, hand hygiene and cough etiquettes.
Corona infection, it's a new infection and nothing much is known about this virus. You call it treatment or you call it prevention. The only thing which helps is social distancing or physical distancing. Along with it, you have like hand hygiene, washing your hands very frequently.
President of Public Health Foundation of India, Dr. K. Srinath Reddy said India is in a much better position as compared to the rest of the world as far as the COVID-19 cases are concerned, and the measures taken are yielding results.
We started getting affected later than many other countries, but we are presently in a much better position than the rest of the world, and in that sense, we are better protected. However, we still have to watch how the epidemic advances over the next 2 to 4 weeks before we can come to a judgment. But right now, it appears that our measures taken progressively from February and peaking with the lockdown are now paying dividends and showing results.
In Uttar Pradesh, more than 50,000 migrant workers and students who were stranded in other parts of the country due to the lockdown have reached their hometowns. 2 trains from Maharashtra carrying around 2,300 migrant workers have reached Uttar Pradesh, while 2 more trains from Nagpur and Amravati are on the way. Our correspondent reports that 2 trains from Gujarat have also reached the state, and 5 more trains with migrant workers on board are on the way.
Process of safe return of migrant workers from Kerala, Punjab and Karnataka is also underway. Today, 5 trains with migrant workers from Maharashtra, Gujarat and Karnataka are reaching, and around 10,000 buses of UP State Transport Corporation has been arranged for the return of migrant workers to their native places. They will be received by the district magistrates in their respective districts, and their medical checkup will be done before sending them to home quarantine. More than 50,000 teams of health workers have been arranged for the medical checkup and screening of these migrant laborers at quarantine centers. All these migrant workers will be provided fresh food at community centers through community kitchens, and government has made arrangements for 11 lakh persons at quarantine centers across the state. Sushil Chandra Tiwari, AIR News, Lucknow.
Bihar Chief Minister Nitish Kumar announced that the rail fare of stranded migrant labourers and students returning to state will be borne by the state government. Releasing a video message today, Mr. Kumar said railway will bring them from different parts of the country to Bihar and their fare will be paid by the state government. All migrant labourers will be kept in quarantine centre for 21 days. All of them staying at the quarantine centre will be given a minimum amount of 1,000 rupees each when they return to their homes after completing the quarantine period. In Madhya Pradesh, shops and other commercial establishments open today in 43 out of the total 52 districts of the state. Remaining 9 districts, including Bhopal and commercial capital Indore, are under COVID-19 red zones. However, liquor outlets remain closed across the state. Our correspondent has filed this report.
Shops opened in 43 districts coming under the green and orange zones with some curbs and stipulated timings. There were also some minor relaxations outside containment areas in the red zones. People were seen making purchases at shops in areas falling under the green and orange zones, and life was limping back to normal in rural areas. In the state capital Bhopal, which comes under the red zone, government offices were opened with 33% staff. However, private offices were not allowed to open in the city limits. Collectors of all 52 districts in the state have issued guidelines for the people on curb to be followed and easing of restrictions in accordance with the centre directives. Sanjeev Sharma, AIR News, Bhopal.
Bringing a great relief and respite for Kerala, no positive COVID-19 case was reported today, second day in a row. Here's more from our correspondent.
It is truly a happy day for Kerala, as not only no fresh COVID-19 case was reported today, but also a record of 61 persons recovered from the disease in a single day. 462 persons recovered from COVID-19 so far in the state, out of the 499 cases reported in Kerala. The recovery rate in the state touched 93%, instilling hope and confidence in the health department. Presently, 34% are under treatment for COVID-19 in the state, which is the lowest number since a month. Presently, there are 84 hotspots in the state. Over 21,000 people are under observation now. Meanwhile, as the third phase of lockdown began today, more relaxations came into being in the state following strict guidelines. Mayusha for AR News from Thiruvananthapuram.
In the Union Territory of Jammu and Kashmir, the District Administration of Baramulla is taking all steps to reach out to the rural people, especially the labourers, to mitigate their sufferings following the outbreak of coronavirus pandemic and the prevailing lockdown. Our Srinagar correspondent has the details.
In its endeavour to provide succour to the rural labour in the wake of COVID-19 situation, District Administration Baramulla has resumed a number of developmental works in rural pockets of the district under Mahatma Gandhi National Rural Employment Guarantee Act. Construction works in about 194 Panchayat Halkas out of 402 is in progress under the scheme. In all these Panchayat Halkas, about 3,160 unskilled labourers have been engaged, while monthly remuneration has been provided for about 312 works. Meanwhile, the Rural Development Department Baramulla has distributed about 5,24,000 masks in rural areas among the people at their doorsteps in an effort to prevent the spread of COVID-19. This is Sunil Kohl for AR News from Srinagar.
People across India have benefited from Pradhan Mantri Garib Kalyan Yojana. Beneficiaries of the scheme expressed their happiness and thanked the government for helping them in this time of crisis.
मेरा नाम राकेश रैना, पंचायत सरानू, डिस्ट्रिक्ट रजौरी। ये जो मोदी साहब ने जो किसानों के लिए जो राशि 2,000 रुपया जो किया है, ये हमारे लिए आज की डेट में एक वरदान साबित हुआ है, क्योंकि जब पूरे तरीके से जो गांव के अंदर जितने भी लोग हैं, जो गरीब लोग हैं, जिनके पास कुछ नहीं था, एक तो लॉकडाउन की वजह से उनको जो मेहनत मजदूरी करने के लिए बाहर जाते थे वो सब बंद हो गया। फसलें कट गई हैं, ट्रैक्टर लगवाने हैं, पैसे की मैनेजमेंट नहीं हो पाती थी, लेकिन जैसे ही जितने लोगों के नाम जो ऑनलाइन थे, जिन लोगों के नाम लिखे हुए थे, सबके अकाउंट में 2-2 हजार रुपया आ गया है।
मेरा नाम नीतू देवी है, मैं मनानू गाँव की रहने वाली हूँ। हमें जो सिलेंडर प्रधानमंत्री ने दिए हैं वो हमें बहुत अच्छे काम करते हैं। वो हमारे लिए जो हमारे खाते में प्रधानमंत्री डालते हैं पैसे, हमारे छोटे छोटे बच्चे हैं, कोई दिहाड़ी भी नहीं है हमारे पास है, जो हमारे खाते में पैसे डाल रहे हैं सिलेंडर बनने के लिए।
Civil Services Preliminary Exam 2020 has been postponed and deferred by the Union Public Service Commission UPSC due to the COVID-19 pandemic situation in the country. The UPSC will announce the new exam date of the Civil Services Preliminary Exam 2020 on 20th of this month. The UPSC was supposed to organize this prelims exam on the 31st of this month for the recruitment in the civil services. The News Services Division of All India Radio in its bilingual live phone-in program tonight will bring you a special discussion program on COVID-19. Dr. Anil Gurtu, Professor Medicine, Lady Hardinge Medical College, will participate in the discussion. This can be heard on FM Gold channel and additional frequencies from 9:25 p.m. onwards. Listeners can ask questions on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444. Khadi and Village Industries Commission, KVIC, today said that certain unscrupulous business firms are manufacturing and selling personal protective equipment, PPE kits, fraudulently using its registered trademark logo of Khadi India. In a statement, the Commission clarified that KVIC has not launched any PPE kit in the market so far. KVIC Chairman Vinay Kumar Saxena said the Commission has developed its own PPE kit made of khadi fabric, which is at various levels of testing. He said selling of PPE kits fraudulently in the name of Khadi India is illegal. Mr. Saxena said that KVIC was contemplating legal action against such fraudsters. He said at present, KVIC is only manufacturing and distributing specially designed khadi face masks.
And now a fact check. Well, Central Board of Indirect Taxes and Customs, CBIC, has dismissed a link doing the rounds on social media regarding GST refund. The link claims that the government has started online processing of GST refund in the wake of COVID-19 pandemic. The CBIC has described it as fake and urged taxpayers not to click on any fake link which promises to give refund. It said these are phishing messages and are not sent by CBIC or GSTN. Prime Minister Narendra Modi today said non-aligned movement can help promote global solidarity and it must remain inclusive in the fight against COVID-19 pandemic. Speaking at virtual non-aligned movement summit through video conferencing this evening, Mr. Modi said India is regarded as the pharmacy of the world, especially for affordable medicines. He pointed out that despite own needs during COVID-19 pandemic, India has ensured supply of medicines to 123 partner countries. He said India accounts for 1/6 of humanity and it is a developing and free society. He said India has shown how democracy and discipline can come together to create genuine people's movement. Union Minister of Rural Development and Panchayati Raj Narendra Singh Tomar launched the Saras collection on the Government e-Marketplace GEM portal in New Delhi today. The Saras collection showcases daily utility products made by rural self-help groups SHGs and aims to provide SHGs in rural areas with market access to central and state government buyers. It is a unique initiative of GEM and the Deen Dayal Antyodaya Yojana National Rural Livelihoods Mission. Under this initiative, the SHG sellers will be able to list their products in 5 product categories, namely handicrafts, handloom and textiles, office accessories, grocery and pantry, and personal care and hygiene. The Rural Development Ministry said that in the first phase, 913 self-help groups from 11 states have already registered as sellers and 442 products have been onboarded. And now, before we end, the headlines once again. Prime Minister Narendra Modi says non-alignment movement can help to promote global solidarity against COVID-19. India is regarded as pharmacy of the world for affordable medicines, says Prime Minister. Recovery rate of COVID-19 cases improves to over 27.5% in the country. Doubling time of cases slows down to 12 days. Government to facilitate return of Indian nationals stranded abroad on compelling grounds in phased manner from Thursday. Indian Railways to bear 85% of migrant workers' train fare and 15% by respective state governments. More than 92,000 NGOs and civil society organizations mobilized by government to combat COVID-19 and help migrant workers and needy people. And UPSC Civil Services Preliminary Exam 2020 postponed due to COVID-19 pandemic. And with that, we end the special news program on COVID-19.